New this morning, today is World Ovarian Cancer Day, and joining us today with a special segment for our Health Alert is Dr. Scot Ackerman from the Ackerman Cancer Center. Thank you for joining us this Friday.
Thank you for having me.
Of course, we appreciate it. We have a lot to cover, so let's go ahead and get started. So first question here, why is ovarian cancer called the silent disease?
We use silent disease a lot in medicine. We use it for heart disease and some other diseases, but ovarian cancer is one of the cancers that's a silent cancer, it's a silent disease. And it's because there's very little signs and symptoms of it when it's in an early stage, and it only is when it's in a late stage you have signs and symptoms. So it's a silent disease because it can get ahead of you and you have a problem and you won't even know it.
And also some other symptoms that women should be aware of and even bring up to their doctors.
Yeah, well, the symptoms of ovarian cancer, the problem is that the symptoms are ones that women would have often anyway. We all, men and women, have gastrointestinal symptoms, bloating, diarrhea, constipation, those sort of things, but they're also related to ovarian cancer. And symptoms that a woman would normally have through menopause, cramping and again bloating again, are also those same symptoms that of menstruation are the same symptoms of ovarian cancer. But if you have those symptoms of bloating or abdominal swelling or diarrhea or constipation that go on for a few weeks and are getting worse, you should see your physician because that could be an early sign of ovarian cancer.
And when you do see them, is there an effective screening test for ovarian cancer?
Sadly, we don't have a good screening test for women who are at average risk for ovarian cancer. But for those women that are at higher risk, we recommend screening with a couple of techniques. Number one, there's a blood test called the CA-125, and that will show us if there's elevation that there might be some ovarian cancer. There's also an ultrasound you can have done, a pelvic ultrasound that looks at the ovaries periodically. But we don't recommend it on the general population because the yield is so low and we find a lot of things that aren't real. So only in those women who may be at higher risk for ovarian cancer.
And that's something to keep in mind if you are at a higher risk. Could your family history play a role in that?
Absolutely. So if you have a mother or an aunt who had ovarian cancer, or if you have a history of breast cancer in your family, or even if you yourself have had breast cancer, that puts you at higher risk. You might have heard of the BRCA gene. We talk about that a lot. BRCA, BRCA gene, associated with breast cancers. That same BRCA gene puts a woman at over 50% risk of developing ovarian cancer sometime in her life.
And as we know, technology is advancing here. Right now, what is the survival rate for ovarian cancer?
Overall, sadly, the survival rate is only about 50%. There's 21,000 women who will be diagnosed this year. Only about 50% will have a 5-year survival rate. But if it's caught early, the survival rate is well over 90%. So I see many women in my practice who are having some funny symptoms like this, and their primary care physician sends them to me. We examine them, we do some testing, we find ovarian cancer caught early. We have them see a gynecologic oncologist, a surgeon, who removes the ovaries and removes the tumor, and they have well over 90% survival rate.
That is good to know. And before we let you go here, what are some resources for people who are dealing with maybe ovarian cancer or family members?
So there's a American Cancer Society. I always speak about them. That's www.cancer.org, cancer.org. They are a great resource for all cancers, and including ovarian cancer. They're non-biased and they're very even-handed about appropriate treatments. And also you can reach out to our office, Ackerman Cancer Center, and our own website. We have lots of good resources for ovarian cancer as well.
And always great information. Thank you so much for joining us this morning.
Thank you for having me.